This is registerednursern.com, and today we're going to look at the question, how do you become a cardiac nurse and what does a cardiac nurse do? And that's a great question. Cardiac nurses, of course, work with patients with various heart issues. It's one of the more popular forms of nursing due to the fact that, heart disease is one of the leading causes of death and one of the most significant illnesses facing society today. And in this video, we're going to give you a little overview of what they do, the job description. We're going to talk about the certification, salary, and general job outlook, okay? So first of all, what does a cardiac nurse do? Well, they work with patients to reduce risks of various heart conditions. They develop plans with patients to prevent future heart problems, and they also provide rehabilitation services from those recovering from heart surgery or recent heart illnesses. Cardiac nurses work closely with cardiologists to help patients by assessing their current risk of heart attack or heart disease. They also help their patients set and meet goals for their health and provide assistance with implementing changes to their lifestyle and diets. The job responsibilities of a cardiac nurse include caring for patients who have a variety of heart-related conditions, including congestive heart failure, cardiomyopathy, unstable angina, myocardial infarction, cardiac dysrhythmia, coronary artery disease, and various other heart conditions. It's important to remember that cardiac nurses provide their services under the supervision of a cardiologist in most cases. Cardiac nurses usually have to have specialized skills to perform their job. Some of the skills that a cardiac nurse will use include things such as defibrillation, electrocardiogram monitoring, administering medication through IV drips, health assessments, stress test evaluations, post-surgical care, and other similar skills. Okay, as far as certification, what do you have to do to become a cardiac nurse? Well, first of all, you've got to be a licensed registered nurse. So that means you have to have either a diploma in nursing, an ADN degree, or a BSN degree, and you have to have then taken the NCLEX test, which is the state board's test, and passed. And when you meet the educational requirements and you pass that NCLEX test, then you can become a licensed registered nurse. That's the first step. And in most cases, that's all you need to do to get on the path of becoming a cardiac nurse. You get your RN degree, you can be fresh out of college, and a lot of jobs will hire you in. They will provide on-the-job training. They'll get you any other additional certifications you may need, and there are various credentials and so forth. We'll talk about that in a moment. But in most cases, a lot of people worry, what do I have to do to become this type of nurse or that type of nurse? In most cases, just graduate from nursing school, get your RN degree. The job itself will provide training and the resources you need to get any additional certifications. Okay, so don't worry too much about that. But as I was saying, the basic criteria, you have to be a registered nurse. Sometimes they may look for 2 years of experience. My wife has worked in cardiac nursing. She actually didn't have any experience. They hired her directly out of nursing school and was provided on-the-job training. But, that can vary in different states. And there's generally 3 levels of certification that you can do to become a cardiac nurse. That's the CBRN1, the CBRN2, and the CBRN3. And those are just different levels. And you can also receive certification in advanced cardiac life support and basic life support. So there's some different areas and some different certifications you can get. Like I said, don't worry too much about that, because once you get hired in, then your employer should be able to help you out with any of that. What kind of salary do cardiac nurses get? Well, like I said, there's a high demand for it because heart disease is a very leading cause of death and a very significant health issue facing society today. According to the Bureau of Labor Statistics, a median salary for a typical nurse, this is across any spectrum, it's going to be about $62,000 to $65,000, somewhere in that range as of 2012, I believe. If you have more experience, if you've obtained a lot of certifications and so forth, the salary can be quite a bit higher. And it also will vary depending on your cost of living. If you live in a large city, you're going to have a higher salary. If you live in some small town that, not very populated, you're probably not going to make as much money. But it is a high demand job, and it's one of the popular areas of nursing, and so you can probably expect a competitive salary with that. As far as the outlook, like I said, nursing jobs in general are expected to increase between 22 to 26% through 2020. So that's one of the fastest growing careers and occupations of all that they studied from the Bureau of Labor Statistics. That's really good. And there's still a shortage of nursing. So if you're interested in the heart, it's a very interesting organ. If you were interested in that, you definitely want to think about becoming a cardiac nurse. And we'd also like to tell you to stop by our website, registerednursern.com. We've got a list of all kinds of nursing specialties with articles, in-depth articles, going through the various requirements and salary and so forth. We also have free care plans, tips on NCLEX, all sorts of great resources there. So you definitely want to stop by our website, add it to your favorites or your RSS reader or whatever you use. Also, you might want to consider subscribing to our YouTube video. And that's all we've got. So thanks for watching. Have a great day.